No vote tonight. President Trump and Speaker Ryan still trying to get enough votes to pass the Obamacare repeal. We're going to take a look at some of the unhealthy aspects of the plan and how the revisions are making it even harsher for millions of Americans. Then the politics of it all. Why President Trump could wind up losing even if he helps win passage of this proposal. Also, drama on the House Intelligence Committee. After Republican Chairman Devin Nunes drops a bombshell about surveillance of President Trump, Democrats livid and some top Republicans, they now say we need a special prosecutor. And now Nunes, even he is apologizing. Good evening and welcome to RFL, another crazy day in our nation's capital. Sounds familiar, doesn't it? I'm Richard French, and thank you so much for joining us this Thursday evening. Well, the House vote on the GOP bill to repeal Obamacare was supposed to be tonight. Well, that's been postponed. It could come, I stress could, as early as tomorrow morning. Leadership simply does not have the votes to pass the thing. That after President Trump and Speaker Paul Ryan were unable to wrangle enough conservatives to vote yes. Now, all the arm twisting by the president and the speaker so far isn't doing the trick. We're going to get into all of the politics, that in a few minutes. But first, what we wanted to do was actually take a look at what is in the bill, and to try and get there, Republicans, they're playing let's make a deal, offering sweeteners to the deal to try and buy votes on both sides of the party here. But for more on what is already in this latest proposal, what could be added next, and the impact the bill may have in our region, I want to bring our senior political correspondent, Andrew Whitman. And Andrew, I know everybody's focusing on the math as to whether or not there's the magic number of votes, but what you spent the day working on was the math for Americans and how it would impact real people's lives the way it's currently constituted. And already there's Republicans in our region, I know Lubiondo in New Jersey, Donovan in Staten Island, that are petrified, if as written, what would happen to their own constituents and maybe their own political futures. Republicans very divided on this.
They are, and in the quest to get more votes, they may actually be dividing themselves even more, Rich. This has all been moving very quickly, and it continues to move with the vote now delayed. But here's what we know about the negotiations so far. It appears to be Paul Ryan offering the carrots for Republicans sitting on the fence on the AHCA, negotiating changes to the bill, and President Trump is wielding the stick, all but threatening the job security of members who say no. So here are some of the changes that are in place in the bill right now. A provision allowing states to provide people on on Medicaid who are looking for work. If they can't prove that they're looking for work, they could be denied Medicaid benefits and by extension be denied health care. Same deal with drug testing. In the bill, states would be able to force Medicaid recipients to take drug tests. Refuse to take one or fail the drug test, no health care. States can also opt to receive lump sum Medicaid reimbursements, not per person payments. Both are changes from how the ACA works. The change would give states greater flexibility on who qualifies and who gets Medicaid benefits. The bill now could beef up tax credits for people between 50 and 65, but that addition is just conceptual right now. The House bill punts this decision to the Senate. The bill, as it's formulated now, speeds up the repeal of some of the Obamacare taxes from 2018 to this year. The taxes on things like insurance plans, prescription drugs, tanning salons, investment income, and more pay for many of the benefits that are in the Affordable Care Act. Another change increases the Medicaid allotment for the elderly and disabled at above the rate of inflation. The original version of this bill pegged those allotments at the inflation rate. It's a concession to the less conservative members from Medicaid expansion states. There is the New York Medicaid county versus state changes, better known as Collins-Faso, or known as the Buffalo buyout. We'll have more on that later in the show. And another change would require people whose tax credits are larger than their insurance premiums to give the leftover money back to Uncle Sam. The bill originally let people pocket anything extra. That is a concession to the far right. But even with all of those concessions, that still has not been enough to get Republicans the vote they need. And the far right Freedom Caucus has spent this day looking for even more. They want to repeal some key requirements of the Affordable Care Act, requirements that insurance plans cover things like maternity leave, preventative services, wellness checkups, rehab services, and emergency services. Their argument that people should not be forced to buy that coverage and that people who want it can pay for it themselves. And as we prepare for a House vote, we're taking one more look at how many people will lose coverage if the AHCA passes. The nonpartisan Congressional Budget Office, as you know, estimates 24 million people will lose health insurance by 2026 if the bill becomes law. And tonight, the Democratic-leaning Center for American Progress is out with a report breaking down the coverage losses by congressional district so we can zoom in better in our region. For example, in the Hudson Valley, in New York's 19th district, represented by Republican John Faso, CAP estimates almost 95,000 district residents would lose their health insurance. In Republican Leonard Lance's district, that's in the 7th district in New Jersey, the estimate is 44,000 residents losing coverage. And in Republican Lee Zeldin's Suffolk County 1st District in New York, 92,100 people would lose their coverage. And finally, across the entire RNN and Fios 1 viewing area, from the Hudson Valley south through the city, Long Island, North and Central New Jersey, and Fairfield County, Connecticut, the estimate, a stunning 2,764,870 people would lose health insurance. That's more people than live in the city of Chicago. That's more than the entire population of the state of Nevada. And it's enough uninsured people, Rich, to fill Yankee Stadium more than 51 times.
As we say right now, they've wheeled in the food and they're negotiating. They're going to try and reach a deal. We'll get into politics because two very different concerns within the Republican Party, and forget even what happens in the Senate. Again, on the math, is it fair to say there's many individual losers? I'll get into a few, but the biggest one seems to be the elderly. The elderly seem to be crushed the most with this, and if you look at least on a political standpoint, who voted for Trump, some of the very people who are supporters might be feeling the pinch the hardest.
Yeah, the way that the AHCA would work would basically to have younger people who are healthier in general pay less, and older people, people between 50 and 65, would wind up seeing significant increases in their health insurance premiums, and that's through the CBO and that's through all the other estimates. The exact group of people that have to pay more for health care in most cases because they have greater health care needs. That stops at 65 because then you wind up with Medicare. And other benefits.
And let's be clear here. We're talking about people, Andrew, in blue and red states. This is not one party would suffer and one wouldn't. Another thing, we talked a lot in this program about the opioid, basically catastrophe that we have in this country that, again, is in urban, rural, suburban areas. It picks no favorites. I saw a crying father who lost his son to a heroin overdose, and people in our area, unfortunately, probably know stories like his. Treatment facilities producing that Narcan is covered, for example, those things go away here. And the stunning tone deafness, forget about what's right and wrong ethically. I mean, you go to poor areas, I don't care where it is, but in red states here, this is exploded right now. That goes away. I think there'll be a shock. I saw the same person who's been to 50 Trump rallies, who now no longer is a supporter. He lost his son to an overdose, and he says, I can't believe he's doing this. He doesn't know what he's doing. These kind of things are sprinkled throughout this repeal.
There are, including women's health and, as you mentioned, rehab and Narcan and things like that. Even physical rehab, I don't think, is covered under the AHCA. So, I went through a back injury, and trying to recover from that would not be covered under it. The other difficult part in all this, Rich, is that despite those stories that we hear, a lot of people really don't know how these moving parts come together. So a lot of people have no idea what the impact of these changes would be. You and I have talked about an article in last weekend's Washington Post in Nashville after a Trump rally. Woman was jubilant that her health care premiums had come down and was gleeful that it was Trump's reform that had done it. Trump's reform isn't in place yet. This was the Affordable Care Act that helped.
Right.
But given how negative the press has been on some of this, and how confusing this process is, even when you're not changing or reforming the system, healthcare is always complicated.
Except, Andrew, I think one of the failures of Obamacare was they did the head count, unlike what we're seeing tonight. It took them a while, but they got enough votes to get the thing passed. But they never really explained what it would do. Now, 20-some-odd million Americans, as a consequence, have insurance for the first time because of the ACA. I think for the first time, Donald Trump is going to be actually able to articulate what Obamacare did if they repeal this thing and they put in anything resembling what we're seeing right now that they're debating, even to make it even more draconian, because people will figure out for the first time what they lost. And they actually had it before. I think this is the first time since it's been implemented 7 years ago that people might finally actually realize what they had because they may lose it.
And we'll see those personal stories pop up all over the place as those changes take effect. It'll be interesting as we see more and more of that reporting, where people assign the blame to it. If they realize that it's Trump, or if they think it's still Obamacare or what the difference is?
I don't know how they can't blame the person who enacted the change, because maybe they didn't realize what it was, maybe they didn't like their premiums, but they had something and now they don't. I think a lot of Republicans, especially those who opted in Medicaid expansion, I think they're worried for a good reason.
And that's everybody in our region.
Well, speaking of the politics of this, when we come back, we're going to be talking about the battle over health care, the stakes, the winners, the losers potentially, and how we believe this will all play out. Andrew and I will be joined by the panel right after this break.